All right, we're live. Hello, and a very warm welcome to yet another exciting session of the Organic Majlis on natural and immune boosters, the rise of nutraceuticals, probiotics, and supplements, a community initiative of the Organic and Natural Products Expo that has been bringing the business community. All right, we're live. Hello, and a very warm welcome to yet another. Organic and Natural Products Expo that has been bringing the business community together for the last 20 years through online platforms and the annual face-to-face event in Dubai every December. This year's expo is scheduled to take place between 13th to 15th December 2022 at the Dubai World Trade Center and will be an ideal platform for you to showcase natural supplements, probiotics, nutraceuticals to close to 10,000 B2B buyers across the MENA region. Of late, people are increasingly looking at preventive medicine to lead better lifestyles and stay healthy. In fact, the global market for nutraceuticals and herbal supplements is set to reach $270 million by the year 2027. Between 2015 and 2020, MENA's nutraceuticals market grew at an annual CAGR of 7.1%. The sector will see a growth rate of close to 10% in the next 5 years as people move from conventional to organic and natural forms of medicine. Most consumers in the region are looking for immunity-boosting products such as probiotics, herbal supplements, vitamins, and minerals to control and treat several diseases. Additionally, increasing consumer awareness of preventative healthcare is contributing to the growth of dietary supplement market in the Middle East as well as Africa. We can definitely see that MENA's nutraceutical supplements and probiotics market is definitely getting a boost. And this is as demand exceeds supply. Without further ado, please allow me to introduce to you our panelists for today's webinar. First off, we have Dr. Kunal Shah, who's the founder, Essenza Nutrition. Dr. Kunal Shah is a scientist turned entrepreneur with patents granted in the USA, India, and China, focused on natural, organic, and herbal health supplements. He's the founder of Essenza Nutrition Private Limited. They're present in over 23 countries and growing fast with a trusting base of over 5 million consumers. Essenza is government-approved research lab and has 2 US FDA-approved manufacturing facilities. Dr. Kunal, thank you so much for joining us this afternoon. It's a pleasure to have you here and looking forward to hearing what you have to share today.
Thank you for having me here.
Thank you. Next up, we have Ms. Bella Shah. Ms. Bella Shah is the operations manager at Muscat Pharmaceutical Trading. She's a diligent and vigilant, enthusiastic professional pharmacist with experience in various countries in the GCC and North America. Muscat Pharmaceutical Trading is a specialized trading company with importing pharmaceuticals, medical devices, surgical disposables, and FMCG goods from various companies. These products are promoted and sold along with goods locally purchased in the UAE market, known for its sharp competition. Muscat Pharmaceutical Trading works with brands such as Sun Pharma, Chloraseptic, Vico Laboratories, Manuka Health, Flamingo, and many more. Ms. Bella, thank you so much for joining us this afternoon. I know that you're very passionate and enthusiastic about this particular category, and I'm looking forward to hearing what you have to say, and I'm pretty sure our audience is looking forward as well.
For sure. Thank you for a lovely introduction, and to be a panelist, I will justify my role as per my passion, assuring you and the participants.
All right. Thank you so much, Ms. Bella. Last but not the least, we have Vinisha Fatnani, who's the nutritionist at New Country Healthcare. As the nutritionist, Vinisha conducts nutritional analysis of potential products against competitors in the market, prepares market intelligence reports, and conducts market research to understand consumer food choices. Vinisha also analyzes nutritional content of products and conducts workshops around Dubai to educate consumers. She also represents the company, answers nutritional inquiries, and supports the director with potential supplier listings. New Country Healthcare has a market coverage of close to 96% pharmacies, 98% hospitals, 89% hypermarkets, and 91% e-commerce. The company also aims to maximize sales through horizontal integrations, market share through diversification of products. With cutting-edge technology, along with our along with their dedicated and highly skilled team, will further facilitate the operational and consumer growth of New Country Healthcare. Manisha, thank you so much for joining us this afternoon. I know it's on such short notice that you've decided to join us. But thank you so much for tuning in, and yeah, definitely looking forward to what you have to share this at this session. All right. I'm going to get right into it, and we're going to have our first discussion point, which is on the current demand for natural supplements and nutraceuticals and probiotics in the region. Like I mentioned at the start, we're definitely seeing a rise in demand due to various factors, due to increasing consumer awareness. The pandemic has had its role to play as well. But Manisha, I'd like to come to you and start off with you. I'd like to know from you what is the current demand that you're looking at when it comes to supplements, nutraceuticals, and probiotics at NCH Healthcare. What role has the pandemic have had to play when it comes to increasing demand for this particular category? Manisha, I think you're on mute.
Sorry about that. So what I feel is the current demand is quite a bit. It's quite tremendous. And I'd owe that to the pandemic. I feel the pandemic has really, in a way, sort of told us to sort of take an insight of our lives and assess the kind of vitamins and supplements that we actually need. And this is what the pandemic did. And statistically, if we look at figures, Euromonitor has recorded a 312 million growth, US dollars growth in the UAE just for vitamins and supplements in 2021. And you can imagine the kind of surge it has had from 2019. It's only set to increase. So I feel when it comes to specific vitamins, vitamin C, vitamin D, even zinc, and a lot of other supplements have gained a lot of spotlight among consumers and even suppliers today.
Awesome. Thanks for that. Thanks for sharing that. Definitely. I mean, the stats definitely say a very big story, but hearing it from you from firsthand knowledge is wonderful as well. Ms. Bella, what current demand are you looking at when it comes to supplements, probiotics, and nutraceuticals?
Post pandemic, definitely immuno boosters are on great demand. However, we have not completely come out of pandemic, and post that recurrent infections, especially viral flus, bacteria, and pneumonia cases have been greatly reported. So the most important parallel to vaccine, healthcare providers strongly believe to strengthen your immunity. And when you are talking about strengthening your immunity, lots of immune support related dietary supplements, as Vanessa rightly mentioned, vitamin C, vitamin D, they were on rise. Along with that, so many combination products have been launched. So it is continuously on demand and it has been stabilized. So it will not go further down, but it will further go based on knowledge, understanding, and awareness how they are offering well-being overall for the patients, for the people who had different infections, and now to live freely, enjoying life without fear. Nutraceuticals, immunoboosters, and probiotics will play a major role to improve health overall.
Wonderful. Thanks for sharing that, Ms. Bella. Dr. Kunal, I'd like to come to you next. You definitely see an export demand when it comes to this category. What products do you have, and what sort of demand are you predicting for the Middle East?
Great question, Suraj. Like I think Vinisha mentioned and you mentioned earlier as well, right? This is a fast growing industry. We're growing at 8% almost, averaging CAGR in the industry as a segment for the VMS industry in general, right? When I say VMS, I mean vitamin, minerals, and all the supplements, including your probiotics, including your herbal supplements and products in general. We at Essenza, we have a wide spectrum of products. So we have about 300 plus SKUs with us. And these are researched and formulated products. We have a lot of clinical trials for these products. As you mentioned in my introduction, we also have products that are patent approved in USA, India, and China, right? And when we talk about the supplement industry, my only goal is to provide people and consumers with research-oriented, clinically validated supplements, right? Because that's very crucial at this stage, right? When an industry in general booms, we see a lot of newcomers coming into the industry with less research and more copycat products, right? Wherein they just copy the therapeutic claims of a certain product, and then they miss the nitty-gritties that have gone behind development of a certain product, which eventually harms the consumers in some way or the other. As you must have read about how Italy as a country banned curcumin in the entire country, right? Because everybody was flushing consumers with 95% curcumin, 500 mg in a capsule, 2 capsules a day, which is becoming toxic for the kidney and liver at the end stage, right? So it is very crucial on what kind of research goes behind these supplements and who's manufacturing it. So we at Essenza, we manufacture our own products. Our facilities are US FDA approved. We are UK MHRA approved. We are WHO GMP approved. We have got ISO 22000. We have halal. We have HACCP. So we have an array of quality specifications within our facility. So this is a clean room environment with HEPA filters, EHUs, and automatic machines where the products are manufactured. And in terms of the products, like I said, we have 300 plus products across all segments. Right, so we've got product in gynec, in men care. We've got products for therapeutic nutrition. We have products for oncology. We have products for dermatology. We have products for hematology. So apart from just your basic vitamins, minerals, and premixes and herbal products, we have got combination products, right, which can tackle each indication at its core, right? So that's what we offer. And obviously this is a growing industry. We are currently present in about 23 countries. We are present in some North African countries as well. So we have presence in the MENA market, but we don't have presence in the Middle East and the Gulf area, right? So this is where we are looking to explore and expand our products.
Wonderful. Thanks for sharing that, Dr. Kunal. It's very nice to see that companies like yourselves based out of India are looking to expand into the region. There's definitely a demand, like you mentioned, and we're definitely looking forward to innovative and much more better quality products. Thank you so much for mentioning about HACCP, halal, non-GMO. I'm going to come to that and try and address that in the later half of this particular discussion. I think that's something very important that we need to touch base on. But for now, I'd like to come to you, Vinisha. What we know that there's a lot of demand, and we're seeing increasing demand for the entire category, that is supplements, nutraceuticals, and probiotics. But what categories under each of them are you seeing most demand for?
So when it comes to supplements, for example, then one that is very common at the moment, if Bella had a very interesting point that now there are a lot of combination of vitamins and supplements, and that is true because 40% of our market, if we see in the UAE market, is actually a combination of vitamins and supplements. There are supplements or dietary supplements which offer a variety. So I would say within supplements, vitamin C would be very important. D is extremely important in the UAE because even though we have sunlight in this region, a lot of us are actually suffering from vitamin D deficiency. So I would say that would be a very important category. When it comes to probiotics, a lot of emphasis is given towards probiotics for women because gut health is super important. And as a woman, stages through different ways of her life. The probiotics in our gut is reduced. So I would say probiotics is something that's growing as well. There are specific supplements, like if we see zinc or, we see omega-3, that is gotten the limelight as of now. I would say that is where the focus lies, because consumers and even suppliers are realizing that it's not just these vitamins which are very important. It is actually the omega-3 and omega-6 ratio that is in our bodies through our food, which is not ideal. So we need supplements like omega-3 to help us fight, to make our immune system stronger and to help us fight diseases, or even the pandemic for that instance. So I would say omega-3 is another important aspect, which is gaining spotlight, and a large part of supplements which is gaining popularity among consumers.
Awesome. Thanks for that, Vinisha. I think coming from a nutritionist, I think this is very, very nice to hear, and very educative as well. Ms. Bella, what do you have to say about this? Which categories under each of them are you seeing most demand for?
What we found during the pandemic, tremendous growth of Manuka honey, which we have been selling in UAE. We have across UAE more than 2,000 customers, retail outlets, and the premium chain groups. However, overall, we have tie-ups with other 2 countries in MENA region. That is our head office, Sultanate of Oman, Muscat, and Qatar, our subdivision. So 3 countries found maybe 10-fold rise in the consumption of Manuka honey, which is assuring in so many ways immunity by giving antibacterial, antiviral, antifungal activities, plus improving gut health. And even it has been promoted for long time for H. pylori to gastroenterologists. So overall, for gut health and immunity, we saw tremendous growth on Manuka honey in particular. Then definitely, as Vinisha rightly mentioned, vitamin C, vitamin D3, omega, but I found some combinations. And soon we are launching during Corona time. Definitely, government sector has been using greatly combination of vitamin C with vitamin D3 higher international units. And as she mentioned that in spite of taking daily vitamin D3, different SKUs and different strength, people are missing out the absorption part. And that is very important. Maybe Dr. Kunal Shah can focus. He must be aware that now, as per Canadian health guidelines and the North American guidelines, the newer combinations are up in the market and growing demand will be noticed soon. Vitamin D3 with K2, as well as type 2 collagen. And that is so much of importance from the part of absorption. Few people only have idea on vitamin K2. So my colleagues who are on panels today, they will also share if they have some idea, but definitely we are launching some combinations which I am mentioning. There is demand, and whatever demand now in North America or in Europe, definitely now globally, we are very close to each other. So MENA region is also pro to those products to consume, and they are keen to have, as per Dr. Kunal's mentioned, standardized product. So label instruction, FDA approved manufacturing sites, plus clinical data. Who should use? So last, if I will address to probiotics, there are 4 groups: infants, children, adults, and people having some medical conditions. plus one more condition, pregnancy and breastfeeding women. So people are confused when in the market it is available. So there we play a significant role, that what type of probiotic doctors will write, sometimes they will recommend, but customers will decide whether they will buy out of their pockets and why. But if assurance is given that these are the standard products which will help, how long to be used, why to use, and what benefits they will get, they should have a very clear idea. Otherwise, they encounter interactions with their regular medications, they encounter maybe not good benefits, and they may encounter side effects. So proper understanding to be given is our major role as a distributor and marketer through our field force.
Well, thank you so much, Ms. Bella, for that. That was very, very elaborate, and thank you for breaking it down for all of us. Dr. Kunal, like Ms. Bella mentioned, there are certain products that are in extremely high demand over here in the region. And apart from the products that are usually otherwise sold and which are otherwise also in demand. But my question to you is, what products would you be looking to push into the region, considering there is specific demand here for certain products?
Right. So, like Bella mentioned just now, right, vitamin D3 plus K2, these are emerging products, and we have seen some crazy demand for these products in the Western world, right? We have a brand with a specific combination of vitamin D3 plus K2. We have a brand for multiple products for including collagen, right? Type 1 and undenatured type 2 collagen, right? Which is doing phenomenally well in the Western world again, right? Then we have a unique set of combination probiotics, right? For specific indications, which is doing well, right? Apart from this, we have launched an entire new set of product called the Tiny Secret. Right, this is called the Tiny Secret. It comes from the ideology of these little secrets that have been passed in the Indian heritage from generations to generations, right? And with the modernization of manufacturing practices and with the modernization of consumer trends, what we have done is we have tried to communicate these little secrets that have been generationally passed in the Indian heritage, in Ayurveda, in the herbology therapies, right? We have tried to modernize them. So we are giving products for specific indications in dosage forms like effervescent tablets. We are giving chewable tablets. We are giving mints, right? So we are giving mints for insomnia. We are giving mints for digestion. We are giving mints for immunity building, right? Which are consumer friendly, right? Anybody could pop a pill. It will taste just like your natural pill. It does not have sugar in it. It is sweetened naturally with stevia, right? And these are all veg, vegan, halal, non-GMO products, right? With this, we also added a new set of products which are basically herbal concoctions, but these are flavored, right? So when a consumer has it, they can have it like their chai or their coffee or their green tea, right? But this will be flavored, right? So we have a passion fruit flavor for tea for insomnia, right? Which has beneficial results, and these are all actual formulations, and these are studied formulations, right? So this will have vitamins, minerals, and herbal ingredients in them, making them potent formulations which are consumer friendly. So mints are easy to carry. You can pop a pill at any point of a time in a day, right? Teas, you usually have your sachet of tea with you. You can carry it whenever you want, consume it whenever you want, or probably on the go when you're traveling, in a cup, or at your office, workplace, at your home. Very easy to convey. And then we are coming up with smoothies. Right, so these are going to be researched powders for smoothies. They're not just protein based, but these are all vegan protein based products, which we feel will do good in the Middle East market.
Wonderful. I think that was very elaborate. Thanks for sharing that, Dr. Kunal. Once again, I think you're trying to address a specific demand in the market, and I'm pretty sure you will receive the response that you'd like to receive for your products. Moving on, I think Ms. Bella touched upon a very important point, and that's about boosting immunity. This has become a very important thing post the pandemic or during the pandemic. So I'd like to ask, what sort of what products or what supplements, nutraceuticals are you looking at when it comes to boosting immunity? Would that be nutraceuticals? Would that be supplements? What exactly is helping people with their immunity levels these days? Ms. Bella, for a change, would you like to go?
Yeah, definitely. I'm very keen to share. Since pandemic, everyone has increased awareness about their immunity. But people are sometimes confused, having so many varieties of nutraceuticals, immunoboosters, as well as the other products, herbal, natural, Ayurveda. So all are ready to serve the consumers, customers, but how as a pharmacist, we play a significant role. So many patients suffered different medical reasons. We are selling prescription products. So antibiotics played a significant role, right? Then we are selling cardiovascular product, that is a heart care product related to blood pressure, cholesterol, diabetes, kidney care, liver care, and the most importantly, we have a fantastic product. During Corona, we played a vital role to save patients' life for intravenous product called Cascofungin. So who were on critical illness, we have played significant role to supply continuously across UAE in each healthcare segment and each setup with intravenous paracetamol injection. That was the first indicated guideline to control high fever. Right? Then the oral, when patient is unconscious. Now post recovery, it takes time. And at that time, if patients are given for longer time antibiotics, it has definitely affected their gastrointestinal tract, that is a gut flora. And to balance out gut flora, the need arises of prebiotics and probiotics. Then come nutritional supplements, mainly rise of vitamin C, zinc, D3. But definitely body is becoming so fragile, so weak, and the antibiotics definitely contribute declining immunity. So if patients are taken care and the healthy people are worried about their well-being. So for that, we have, I will say, age-old product, Dabur Chyawanprash. Then we have 10 years and significantly proven clinically for cellular level repairing Manuka health. I'm not promoting my products, but Manuka honey across UAE, more than 12 varieties. But once upon a time, we were premium seller with a premium brand. And now all of a sudden, rise of more than 12 or 12 plus brands available. It indicates the consumption has widely increased and the awareness when it has started selling in the premium supermarkets, FMCG market. Now coming to nutraceuticals, it requires to go on immune support type, so many products, but so many antioxidants. And which are the antioxidants? Sometimes you have to check with your physician or you check with the retail pharmacist. Read the label instruction. We have effervescent vitamin C tablets. Sometimes it could be right to continue for a long time, or sometimes you need to have a break and change to multivitamin or B complex or as per your body condition. So consumers should have idea how long to be used this immunity support related supplements, nutraceuticals, and probiotics. When to take, why to take, how to take becomes very important. Having thorough knowledge and all these aspects related, we recommend any person takes antibiotics for longer time. Definitely they should check, even if not prescribed, for probiotics to balance out their gut flora as well as to give better absorption by probiotics for whatever other medicines they are taking. Otherwise, there is a word called treatment failure. Having no knowledge of supplements, people are not getting outcome of the treatment they are given. And sometimes it is missed out. And that is the main reason over-the-counter products are surging high. And slowly, people have become very alert of use of antioxidants. So they should have understanding what are antioxidants. I will say direct to stay in contact with the pharmaceutical people, retail pharmacists, and the doctors who are treating for the people having conditions, and for normal adults, they are fine, but they are on the go eating lifestyle. And in that, they may lack so many required important nutrients. I will say iron deficiency. I will say vitamin D3 deficiency in the youth, in sports goers. And you might have heard people having no understanding when they go to gym and they have collapsed. Have you heard this? People having condition, inherent diabetes, and they should have understanding why to take ORS. So we have, since 10 years, WHO recommended ORS soluble tablets, and it was greatly selling across UAE, including, I will say, Emirates flights. And at the airport, anyone will go to UAE, they will find a big board, because ORS soluble tablets is a life-saving product, is proven. Any person having a tremendous low sugar, and if you want to rescue during flight, this is the option. And at the same time, it is one of the dietary supplement. Am I right? So people should be aware of so many newer, latest additions. Newer means, I will say, since 10 years. But the awareness, knowledge, and such workshops will bring alerts. How, why, what, which products are suitable. And right from the birth till the, I will say, breathe out, breathe in to breathe out, there is a need of immunity boosters, whether it could be Ayurveda, herbal, from their daily consumption, or their finicky eating style they can maintain with the healthy nutraceuticals. So these are some products. We are part of UAE's and MENA region population to witness well-being, to have a good immunity, to stay away from easily getting infected. So thank you so much. I took some time.
No, Ms. Banat, I think you've touched upon very, very important points here. Especially when it comes to the lifestyle that we lead. I think immunity takes a back seat. So I think that being said, I think it's a responsibility of people like us to educate consumers on what sort of supplements or nutraceuticals and probiotics that they need to take to sort of maintain a healthy quality of life. Vinisha, I know Ms. Bella summed it up quite well, but is there something that you have to add to that?
Yeah, absolutely. That was very enlightening. Thank you, Ms. Bella, about it. And I agree with her completely. Consumer awareness is super important. It's very important to know what you have to take. Just to touch up a little bit on immunity in terms of supplements that, boost immunity, I would say echinacea is a really good supplement that boosts immunity. Elderberry and sambucus. It's growing in the UAE. These three are very important. Even ginseng extracts, I would say, which comes from ginger, is very important for anti-inflammatory boosting, ingredients in our body. I would also urge consumers, of course, supplements are super important. Even at New Country Healthcare, we have brands like Now Foods, which launch such supplements for boosting immunity. Having food which is rich in antioxidants is super important. So it's very important for consumers to have your berries. I would ask them to also try organic apple cider vinegar, or a healthy diet with nuts and seeds that boosts immunity as well. So I would say a mixture of good supplement as well as food would be very important.
All right, wonderful. I think Ms. Bella and Vinisha, you guys have summed it up really, really well. I think that goes beyond answering my question. Dr. Kunal, I'd like to come to you. What products do you have when it comes to boosting immunity? Because like Ms. Bella and Vinisha have mentioned, it's definitely something that people are increasingly paying attention to, these, especially post the pandemic. So there's definitely going to be a demand for that. What products do you have at Essenza?
I think Ms. Bella and Vinisha already mentioned some of the products that we have here, right? Echinacea, elderberry, apple cider vinegar, vitamin C from natural sources like orange and amla. Then we have ashwagandha products. We have turmeric-based products. So I think we have about 15 to 20 such products which are only focused on immunity building, right? Because that was the need of the hour. We developed more products, and we always had an array and an urge to develop products for the immunity segment, and we have been. So when we started 10 years ago, our first set of products were immunity boosting products, right? Because these there's a wide array of applications for immunity boosting products, right? And this was one of the most researched products. And easy to research products also to some extent, right? So we started with that. So in terms of products, we have, like we mentioned, apple cider vinegar, ashwagandha. We have turmeric with 95% curcumin. We have ashwagandha with 5% vithanolides, right? We have vitamin C. We have D3 plus K2. We have vitamin C plus zinc. We have vitamin C. We have iron plus zinc. So vitamin C plus iron. So we have many such combination of products that go across depending on the type of consumer and the type of market, right? And we being the researchers, we being the manufacturers, we always have this upper hand that we can custom make the product as per the market, right? So even as we are present in 23 countries, and we may have the same brands across, right? So we go by three main brands. One is obviously the company name Essenza Nutrition, and the second one is the Tiny Secret, and the third one we call it Proyurveda, right? Which is where we have got a combination of probiotics with Ayurvedic herbs. That's how the Proyurveda word has come, right? And me, myself, if you see my social media, right, I'm called Dr. Proyurveda because that's how I'm known in the industry, right? So if you see my social media handle, it will be dr.proyurveda is Dr. Proyurveda. That's how you find me online, right? But I think something that both Bella and Vinisha mentioned here, which is very crucial, is consumer awareness, right? And for the same, we have recently started this initiative where I am writing blogs, and these are really detailed blogs, right? These are 4 or 5 page blogs. To some extent, I feel that they're kind of cumbersome for the consumers, but if consumers really deep dive into these blogs, they will get a lot of knowledge in terms of how to consume these supplements, right? Because one biggest aspect of supplements is they are safe. These are all US GRAS status, right? They're generally regarded as safe. They have less toxicity even when consumed in higher doses or over consumed, right? So even when this happens, there are certain aspects of supplements that should not be combined with certain medications. Or supplements that should that should be taken with a little bit of awareness, right? Like let's say you're giving a D3K2 supplement, right? And but unfortunately a vitamin D3 won't be absorbed in your body until it is taken with fats, right? So if consumers are not aware about it, or I don't put it on the pack that you have it with a glass of milk or you have it with something which is fatty in nature, this D3 is not going to go into the body and not going to give you the results that the product would usually give, right? Like if you're taking a calcium supplement without D3, again, you're going to face the same problem, right? So it is very crucial on us educating the consumers, and the consumers taking a little bit time to educate themselves on how to consume the supplements available in the industry today.
All right. Thank you so much for that, Dr. Kunal. Very, very interesting to know some of the products that you're looking to bring here into the region. Also, I think I will stalk your social media before I leave for the day. I think you'll have some very interesting stuff to share over there. All right. Ms. Bella and Vinisha, I think this question is for you. And considering we here in the UAE, close to 95% of the products here in the region are imported. There isn't much that's produced here. I'd like to know and I also know that both of you work with a lot of suppliers and work with a lot of exporters who are looking to export their products here into the region. But what is that one message that you would like to give to your suppliers, or say a potential supplier who's watching this and who has the right products and is sort of satisfying the demand? What is the message that you have to give for them, Vinisha?
So I guess the message that I would like to give all the suppliers out there, to any entrepreneurs or scientists or anybody who is interested in developing such products as well, I would suggest that it's very important that the ingredient list is super clean. It's very important that the product is well placed in the UAE. It takes care of cultural traditions, that the products have to be halal. They have to be very high in quality. They have to have the right certifications, as Dr. Kunal said, like HACCP and ISO regulated. That is super important for the UAE. It is also very important that even if you have a wide range of products, your brand and your products should have clinical studies. Because, for example, we take vegan collagen. It is something that's coming up recently. We know that collagen usually comes from animal sources, but now vegan collagen is coming up. So there are a lot of brands out there that have vegan collagen, but it would be great if they have some studies or some clinical trials, some proof. And I guess, coming from New Country Healthcare, we are people who are constantly looking for scientific evidence. And same goes for suppliers, same goes for retail chains. So if we are confident in the product is when we will be able to sell it in the market as well. So I would suggest suppliers to make sure that their products are of super high quality, that even the shelf life is maintained as well. That would be a very important source. And the instructions of how the usage of the product is and the kind of packaging it has to be very user-friendly for the UAE, so that it is interactive, so that the consumer understands what's on the label and would like to pick it up and say, oh, this is interesting, or I find more information on this one. I think these would be very important points to consider for all the suppliers out there.
Definitely, Vinisha. I think you've sort of laid it out very, very comprehensively there. It's always a gray area for a lot of people who aren't familiar with the region as to how their products need to be. But I'm sure whatever you've shared will definitely be of great help to them. Ms. Bella, I know you've been here in the region for quite some time, and you work across not just here in the UAE, but across Muscat and even Qatar. What is that one message that you have to your to suppliers who are, sort of want to work with you or sort of get into the region?
I would like to give message. First of all, I will add on to Vinisha, so it will not be on duplication. Scientific data are asked by government authorities. So when you are planning to get any product across the globe, which we are selecting very carefully, and our very first question, in country of origin, the regulatory status. Secondly, clinical data plays a very significant role for our purchasers. Now, our purchasers are hospital-based attached pharmacy, polyclinic attached pharmacies, as well as standalone pharmacies, and the premium group of pharmacy. So awareness is very high. If registration is done under the category of Ministry of Health and Prevention, then those products are more standardized, because government itself has opened that segment, that this will be sellable in FMCG or not. This will be sellable at pharmacy level, hospital level, government sector, why and not. So they are also having very clear cut guidelines for us to select the brands. Based on scientific data, we are able to reach to the prescribers, recommenders, as well as the OTC way explaining pharmacy healthcare providers. So these all we have to respect to continue on a requirement of consumer as well as government. That is a very important balance. We are having very premium brands which are internationally famous. They are Dabur, they are Valex, Ayurveda. We have Charak Rushi. If I will say, people may understand, may not understand, but they have immunity boosters like extra immune tablets, okay, and syrup for the babies as well as adults. Then coming to Chavanpras and Pudinhara, Tulsi drops, which are basil drops. So they are age-old products consumed, and they are already going on. Then further going, one segment which we have not addressed is homeopathic medicines from North America, because we found extremely high demand of cough cold products, which we missed out, but they are also supplements. But they are registered under Ministry of Health for the not only shelf life, but for stability reason. So how far product remains very good. So here, after screening out all these labels, we have been marketing more than 7 years. And during this post-pandemic, these first 2 quarters, so many cases of cough cold, if you have heard, in the air. It could be viral, it could be bacterial, it could be any reason, but we have fantastic products, cough and cold, as well as calm product for the babies, birth till 9 years. And now we have just recently introduced back to school to sustain the immunity products, which are 11 years, has been launched in Egypt, made in Egypt, but with nanotechnology. And first time UK has asked all the requirements to go ahead and to market. In Europe, they are Calcibella, Nutribella, as well as I will say Ferrobella. When we are talking about vitamin D3 absorption, when we are talking about D3 is one of the major vitamin, everyone will agree, for immunity building up from birth till death. So all these products we have to have standardized by registering, and lab analysis becomes important. Then only consumers feel happy to consume with the efficacy they will witness. and the repeat purchase, they will only go on by word of mouth spread, not a forcible way. Use this, use that. But in our our forefathers, grandparents, they have also practiced the importance of turmeric, black pepper, ginger, and cilantro. And now they have come in the form of nutraceuticals. So it's a newer, latest version, and how much suppliers are promising on quality, on standardization, and efficacy becomes important. So I have just sum up overall, and linking with the generation gap will not remain for the upcoming generation as well as the ongoing generation to remain fit and to encounter any disease or infection, as long as they are aware the role of all dietary supplements, immunoboosters, as well as probiotics. Because if gut health is not good, I doubt on pharmaceutical version way, absorption, metabolism, distribution, and excretion, which includes heart, kidney, liver, the most essential parts. And of course, brain. Without that, nerves will not function well. So musculoskeletal conditions, for all four conditions, very important role supplements, nutraceuticals play, and people should have more curiosity to get to know. And MENA region is growing to satisfy the need of the consumers for such a standardized products where K2 will play a significant role. I will say in MENA region, it will be a really, really breakthrough if D3 is absorbed, because so many reasons, osteoporosis, arthritis is subject of discussion in MENA region. So it is linked with the hormones.
Thank you so much.
I'm done here. I consume a lot of time.
No, thank you for answering that question very, very well. I think for a supplier or someone who's who would like to get his products into the region, I think you've sort of given a cheat sheet. So that was definitely of a great help. Dr. Kunal, I think we're almost out of time, but I'm going to come to you. But I'm going to I'm going to pose you a different question here. What is it about the MENA market? What is so lucrative? Why are you looking to expand here into the region?
Yeah, so I think for us it is so from the 23 countries that we are present in most of the markets, right? We are there in the European market, we are there in African market, we are there in Southeast Asia and Asia, of course, right? And we are there in CIS, right? One region that we are not very strongly present is the MENA market, right? And especially the Gulf side of the MENA market, right? So so that's why it is we are keen on expanding in this market, obviously. Second is this is a fast growing market here today. We could also say that MENA market is a gateway to the globe, right? Because you have people from all communities, all cultures working in, especially the UAE part of the country, right? So we have people from all caste, creed, religion, communities, and areas of the world coming here, right? And it's like a global platform to showcase your product to the entire world, right? So it only naturally makes sense that we have our products in this market as well.
That's great. Wonderful. I think we are at the very end of the first half of this discussion. I think we've had some wonderful points discussed. Thank you so much, panelists, for sharing your thoughts. I would request you all to stay on the same call. You may wish to switch your video off. And we should be back shortly at 4 p.m. for the second part of this discussion, which, again, I'm looking forward to.
Thank you, Suraj. Looking forward to it.
Yep, thanks.
We've found UAE partners. We've also found people coming from Iran, from Oman, from Qatar, Saudi Arabia, lots of places. Pretty good so far. We are in the third day, and we've already met lots of partners. Also, the organization has been really helpful with us, so we are pretty grateful.
To be honest, Ukraine is the first on the world in exporters of the organic products. And after we had a survey with the Ukrainian companies, we understood that the Middle East is the second market we would like to open. That is why we are here and trying to find our partners. I think it was perfect. We had only 3 months to organize this pavilion, and as you see, it's working great. We had a lot of contacts and potential buyers, so I think we'll communicate further. And for the next year, I think we'll also plan this exhibition to participate here.
It was a good experience. We would repeat it next year probably with our distributor. You see, I think that the kind of audience that we met is pretty diverse, and this is what is also interesting, right? On one side, we met consumers. They're going to buy on our website because in 2 days we're going to launch e-commerce. We met also distributors, not just for the UAE, but in general for the GCC countries. We're looking for someone in Saudi Arabia. We're looking for someone in Qatar. So we definitely are going to be here next year with our UAE distribution. And then we met a few retailers, and this is why, I think that there's a lot to build into the retail side of the business to, meet the market trends and then starting opening up the real organic stuff in the UAE. Clear progression to the future, and I think that that's the step forwards that retailers in the UAE and then also in Saudi Arabia will have to face over the next future.
Really nice. In fact, we are super happy because we receive really good potential clients thanks to the organization, because you come with nice people, and I hope that we will finish and with good deal and with good sales. Discuss with our team, we are super happy, and maybe we will come next year. So we need to study the strategy, but I guess that this is one of the best events, one of the best fairs regarding organic and cosmetics. UAE mainly, but from Kuwait, from Saudi Arabia, even from India, Pakistan, Iran. So all the area, not just from here, from Dubai or UAE, but from all the area. So that is really, really nice, because in one point you can meet people from different countries. So that's fantastic.
It's obvious. Currently, organic and natural trends are growing up everywhere in the world, especially here in the Middle East. We understood that Russia has not only the great potential, but the actual products which are getting produced in the entire Russia. We have 85 regions in Russia, and all of them have really natural and unique products. And we thought, why not bring them to UAE as the entry point for the entire Middle East? That's why, as of now here, we're available with 42 companies from Russia.
All right, we are back for the second session of this particular webinar. I think we've had a very, very interesting first half. Thanks to the insights that all of you had to share, and I'm pretty sure we're going to have an even better second half. I'm going to come to a very important aspect of when it comes to this category, and that is on education. I think we as stakeholders of the community, it lies on our shoulders to educate the consumers on the latest on what supplements, nutraceuticals are, and what sort of an impact it can have on their life, along with obviously what they should be taking with and to ensure maximum effectiveness. Manisha, I know you're a nutritionist. What role, or how important rather, is it for people like ourselves to educate consumers on the importance and on the impact of nutraceutical supplements and probiotics?
As a nutritionist, it's super important. I would say that consumer awareness is very helpful, not only to us, but to themselves as well. Because to begin with something very basic, like to start off with vitamins, there are different kinds of vitamins. We have vitamins which are water soluble, like B and C, and we have ones which are fat soluble, as Dr. Kunal suggested, which are supposed to be taken with fat and supposed to be taken after a meal, like vitamin D. That is supposed to be taken after a meal. And I think, this information is something that's very basic, but if we inculcate it even in children in schools as well, or even among teenagers, for example, there are various governmental bodies in the UAE which do a fantastic job in ensuring that the schools have the top education. It would be great if we have some kind of initiative in schools to start off with children, and of course the pharmaceutical industries that we have today, like the retail chains. It would be very important for the person or a pharmacist on the other side to educate any consumer who comes into the pharmacy to buy something very basic, but to leave the pharmacy with a lot of information, a very, very useful plethora of knowledge. And that's super important. So even something as basic as, vitamin D is supposed to be taken after the meal, not before the meal, not empty stomach, just for the maximum absorption. Something as simple as that would really help consumers at the end of the day. So, as I would just like to sum up to say, that's how important consumer awareness is, because the more we know about this, the maximum absorption we have in our bodies, and the better our immunity is at the end of the day.
Definitely, Vinisha, I think you've laid it out quite well once again. I think it's important, and the onus is on us to educate the audience and the consumers on the effects of, not only on the effects of nutraceuticals, but its importance as well. Dr. Kunal, I know you've been in the industry for quite some time now, and you have seen the industry transform. I think people are a lot more aware in the post-pandemic world on how important supplements and nutraceuticals are. But how important is it, and what are you doing to educate your consumers?
Right. So one thing I think Vinisha or Bella mentioned earlier in the last session was, what kind of information are we putting on the packaging, right? So we did something about it. All our recent packagings, right? One is we can always put a leaflet inside the packaging which educates the customer, right? But then that becomes very cumbersome and people don't look into it because those are tiny fonts and boring literature, right? Who would want to read that, right? So from a regulatory perspective, it goes well, right? Because certain ministries will make it compulsory to put in that information, right? And it has a plethora of information, right? But what happens is consumers don't really read it, right? So the recent packaging that we launched with the Tiny Secret, what we have done is, and because the name also plays with secret, right? We create an educational format for the same, for the consumers to play around on the packaging itself, right? So we have a nice logo on the top which says, did you know? And, before you open your packaging and get into the product, you can open that. right? And then you can scan a QR code that takes you to our website, and it will give you loads of information on how to have the product, when to have a product, and what other combinations you can have with this and what not, right? But to ensure that consumers, don't feel kind of monotonous with this, right? We put in another secret. Did you know? Which changes every batch to batch, right? So the next time they get their product, the next month or the next fortnight, right? They will have separate set of information in there. This is something that we have started doing with our packaging, right? Making it fun, making it play while educating the consumers. Obviously, second part was like I mentioned in the last session that we have started putting out blogs on LinkedIn, on our website, right, to try and educate more consumers about the entire industry in general, the supplements in general. I think we've published about 4 to 5 blogs right now, and we've talked about calcium deficiency in general. We have talked about how we are tackling the calcium deficiency with not just the calcium salts, but 100% natural cow milk calcium, right? Then we talked in a blog, we talked about how this cow milk calcium is lactose free and can be consumed by everybody, right? So we are talking about different things, and we are trying to put information as consumer friendly as we can. So it's easy for people to connect to, it's easy for people to understand and make it a part of their lives, right? We talked about the gut in general in one of our blogs. Then we talked about the brain, and then we talked about the gut-brain connection and the gut-brain axis in a recent blog, right? Now we are talking about antibiotics, the overdose of antibiotics and antibiotic resistance, which is a threat to the entire health of the people in general, right? So we're touching points on a lot of issues which are not really spoken of, right? And where there is a lot of information available, but not vital information, right? So we're trying to create a story in a way where it's consumer friendly and people understand it, they can relate it to their lifestyles, and then they can make specific changes into their lives where it matters to them, right? Basically, we want consumers to take educated guesses, right? That's what matters in this industry, because there are just tons of products out there in the industry, right? Every day we are seeing, as manufacturers also, we are seeing tons of new companies coming up with who are investing in supplement products, right? Because the industry is growing in general. Everybody wants a pie of this industry, right? Core pharmaceutical companies are now launching a nutraceutical division, correct? So this industry is just expanding, right? And when an industry expands at such a rapid pace, there are a lot of not so good products that also come into the industry, right? And so that's why we're trying to educate the customer such that they can make the right choices for themselves, because unfortunately we live in an era which is all shine and no glow, right? So it's in an industry that if something looks beautiful, if the packaging is nice, if the communication has millions of dollars spent on it, right, that is the product the consumer is going to pick, right? Not the product that actually has a better utility for the consumer, right? So because of which it's very challenging for certain good brands to come up, wherein at certain aspects, certain let's just say, I don't want to hurt anybody's sentiment in the industry, right? But let's just say that consumers should be able to make educated guesses.
Well, I think pretty much ticked off all the boxes when it comes to saying the right things here, Dr. Kunal. I think, and it's also very nice to see that a drug manufacturer or a manufacturer like yourself is, going out of their way to educate the audience. It's not necessary that you have to do this, but you're still going out and doing it. So I think it's important for people like yourselves to come out there and educate consumers, and rightly so you are doing it. So congratulations on that. Bella, I'd like to come to you, and just to brief you, we're talking about the education and how important it is for educate consumers. What, according to you, or rather, how important is it for people like yourselves, distributors and retailers, to come together and tell people on not just the importance, but on how exactly these supplements and nutraceuticals are to be used?
Education is one of the most important parts for consumption, for the selection, and complement with the ongoing regular medications or having no medications. Second thing, how to educate consumers. So many ways. Now, I will say Google plays very vital role for promoting so many nutraceuticals, dietary supplements, but sometimes in haphazard way, if selection has happened, person may encounter allergic reactions of that particular product. So people should remain alert and aware of allergy. As Dr. Kunal said, allergy can happen, resistance of antibiotic, as well as people can react badly to the prescribed medications. Same thing, same possibility for nutraceuticals and supplements and herbs. Secondly, what time period one should continue plays very important role. Over the period, they have to reduce the potency, the strength, and one important factor, QR code, which is mentioned by Dr. Kunal, I will focus. Now in MENA region, especially in UAE, it was before C pandemic, they made even nutraceuticals and dietary supplements related products compulsory to have it. Unfortunately, everything was delayed, but it is upcoming demand. Prescription products all are having QR code, but market is having mix now. Some nutraceuticals or dietary supplements are with QR code and some are not. North America, like in Canada, they have NPN, non-pharmaceutical number, like a DIN number, drug identification number. Here, government is giving if MOH registered product. So some nutraceuticals can be prescribed and covered under insurance coverage when people are suffering for some severe and serious diseases for 3 months, 6 months, that doctor will decide. But all these are supportive, I will say, requirement to remain confident to consume those particular brands. For example, vitamin D3, it is considered as antioxidant as well as immunobuilder as well as a nutraceutical. If I am wrong, please correct me, Dr. Kunal. So vitamin D3 is starting from 200 IU. Okay, in some combination, it could be 200 IU, 400 IU, 800, 1,000, 5,000, 10,000, 14,500, 15,000, and 50,000 and 60,000. And if consumer will start on their own, they should have understanding the benefits of what strength. Only one particular vitamin D3 has more than 10 SKUs and more than 10 plus combination products. So very widely, education plays a significant role.
Wonderful. Thank you so much for that, Ms. Bella. I think, like you rightly mentioned, the onus is on us. So whatever steps we take to educate the consumers, I think that would definitely sort of move the needle when it comes to this. All right. We are right. I think we have about 15 minutes left. So I'm going to try and squeeze in a couple of more questions so that the audience can hear more from you guys. And I'd like to come to you, Venetia. And this is about the challenges that distributors and retailers like you face here in the region. What challenges or what difficulties do you as distributors or retailers here face here in the region, and how can suppliers help in addressing those challenges?
I guess some of the challenges that us as distributors face would be number one, having enough information about the product. So it's just not, a catalog. It's just not a range that is presented to us. We need to have the in-depth information about the product, where the ingredients come from, what is the origin, not just of the product, but of the ingredients as well. What source of, like example, cinnamon comes from different regions of the world. Cinnamon from Sri Lanka is said to be one of the highest potencies and a good quality cinnamon. That's, just as an example. So a simple ingredient from the particular region also causes an impact. So I think the key challenges that we face is having enough information that suppliers could help us with, is giving us, this kind of platform, this kind of information, hosting a lot of workshops from their end, so that even though the distribution is going on of the product, the sales team that is involved, the people who are involved at the counter, are constantly educated. If there's a new product, if there's a new SKU, like a brush up of knowledge would be very important that suppliers can, provide. These are some of the key challenges we face overall. Some of the other challenges would be, shelving the items to ensure that it is properly merchandised, it is visible to the consumer's eye. These are some of the challenges that we would face, because there's so many vitamins and supplements. How can we make one brand stand out the best? Like, what do we do to make that one brand stand out? How do we make sure that the consumer is able to notice the benefits? So these are some of the key challenges as a distributor, and I think the supplier can do their best giving us their knowledge, so that we can, combine two forces together to make sure that the consumers get the best.
Fair enough, Vinisha. Bella, what are your thoughts on this? What challenges are you facing currently, and how do you think suppliers can help address your challenges and your difficulties as a distributor?
Suppliers should contribute for marketing and availability. As Vinisha said, definitely visibility is one of the important aspects. Secondly, shelf life versus expiry. Most of the retailers would like to have more than 1 year shelf life. So availability as per the locations and community segregation, we have to merchandise. More importantly, suppliers should have some now e-commerce way, or even in health magazines or some magazines, nutrition magazines, if they have advertisement with the key features and the selling benefits, then people will have alerts, and they will come to know that such products are marketed. Sometimes it does happen, physicians do treatments, they do recommend supplements. Customers, they do buy or they decide to buy later. So all these supportive tools help to create confidence, assurance to buy, consume, and get the best outcome out of it as per the need.
All right. Thank you for that, Ms. Bella. Dr. Kunal, I know you're probably making notes of what's being said at the moment as you plan to expand into the region. But if I may ask you, Dr. Kunal, what sort of retail or what sort of a export distribution strategy do you have in order to address some of these challenges?
It's a brilliant question. So we are a self-funded, family-oriented business, right? We are a family-managed business trying to make its mark into the industry and spread our wings across the continents, right? So for us, our partners are very crucial because they are part of our families. There are extended families, right? So in any region that we go into, right, whether it's across or it's Middle East, right? It's very important for us that the partners there have their strong local presence, right? A lot of markets we prefer the top three players in the industry who are distributors, right? Because we as a company don't have the bandwidth to have marketing and distribution expertise in a particular country, right? So we are going to rely on our partners a lot, right? So it is very crucial that they have the bandwidth of a good distribution network, a good sales team, and they have good knowledge of what's happening in the industry in general, right? Because as far as manufacturing, research, documentation, compliance is considered, we are experts at that, right? But we need somebody to help us and handle our domestic distribution in that country, right? So I can help you get the goods till your doorsteps. But then if the partner is not an expert at what they do, right, the product is eventually going to fail. Right, because like I said, it's all about. I think Vinesh also mentioned it's all about the visibility also at the retail level. So who has the best connections at the retail level such that they can get that premium square foot space in a retail, because space is a big constraint everywhere, right? And people only have a couple of minutes of visibility when they enter a pharmacy or a shop until they move on to the next aisle. Right, so you have those few seconds and you need to grab attention, right? So we can do good packaging. Like I said, this is one of our packagings where I said, we have this flap that opens up, and then we have this QR code which you can scan, and then there is a little secret. You can scratch this and you get a code for discounts, as well as there is literature here. So we're trying to play around with the packaging. But if the packaging is not present in a premium space, right, consumer is not going to interact with it. Right, so it's all a flop if our partners don't have that kind of bandwidth, right? So we prefer partners who have that kind of retail connections, those who have local people, local team, and they understand the region very well, right? That's the kind of partners we look for.
Wonderful. Thank you for sharing that, Dr. Kunal, because a lot of suppliers and a lot of the people watching this, they'll be wondering on how to enter into region, how to interact with consumers here. And I think they would definitely have a lot to take away from whatever you just shared. All right, this brings me to the last part of our discussion, and that's the future. I'd like to know from each of you, as to starting with Vinesh, obviously, as to what do you think is the future, or what upcoming trends are you predicting for this particular category here in the MENA region?
So when it comes to upcoming trends, I would say that antioxidants is something that has been growing so far. And because of the consumer faith in antioxidants, they sort of understand how antioxidants work now, that antioxidants help to remove free radicals from the body. So I believe antioxidant ingredients like certain immune boosting made from berries, or made from like elderberry was one such example, sambucus was one such example, right? So I feel there are more of these ingredients from these berries that would be something that's very upcoming. At the moment, I feel that moringa is set to grow even further when it comes to anti-inflammatory and immune-based responses for the body. I also believe that a lot of other supplements are set to grow even further. But there's one such category which I personally have a lot of interest in, is vegan collagen. I think that is set to grow even further. Even items which are dairy-free, ingredients or supplements which state the fact that they are sugar-free and they're vegan, I think that's very important. Instead of using a gelatin-based, ingredient, what else do they have in store to have that vegan certification? I feel these are the free from food category. Yes, that is the name that I was looking for. That is supposed to grow further in the UAE and is expected to grow as well. About, if you look at statistically, it is set to grow more than $50 million in 2026. So we have a huge jump to see just in free food. And I'm sure that is set to rely on vitamins and supplements as well.
Awesome, Manisha. I think I would have to agree with you on the vegan collagen part. We're definitely seeing a lot of inquiries coming in on when it comes to that particular segment. So thanks for that. Ms. Bella, coming to you, what sort of trends are you predicting? I know you're an enthusiast and you're constantly keeping track of what's new in the market, but what are you predicting?
We are here happy what consumer demands. So we are continuously through our field force keep researching that market is pro what and what type of products are selling high on demand. Why? Because we have field force to medical side, medical promotion. Doctors are to be involved in the recommendation of all these Ayurveda products, organic products, vegan products, because patients now, so many youth is going, there is a trend of vegan and it is a growing trend. Same why organic food is good. What Vanessa is mentioning very rightly, that collagen is going to be a breakthrough, type 2 especially for musculoskeletal conditions. Antioxidants are going to play a very vital role with all medications because they are looking after inflammation, internal or external. It could be joint inflammation. These antioxidants are so important for eye health, kidney health, even I will say cellular repair, if I can tell in depth this word. Then antioxidants, prebiotics, probiotics, nutraceuticals, along with their other required prescription drugs or their normal food, play significant role to give well-being overall. And who does not want to live healthy on this earth? So everyone is looking for longevity. If anyone is looking for longevity, I will say look for good, authentic, standardized dietary supplements, prebiotics, probiotics related understanding, so their gut health improves. If gut health improves, they can stay healthier, better, and even they can have cheat foods once a week, twice a week, or any time. But overall happy life, overall healthy life, if needed, definitely these products play very, very important, crucial role. And 13% growth is expected at the earliest in coming years. So thankfully, to the severity of flu and sea pandemic, and now people are going regularly for vaccinations. So pneumonia is another problem. When immunity is low, you easily get, probably. As a pharmacist, we have been constant dispensing in North America antibiotics for a week to years. And those conditions are always recommended by opinion makers. They are discharging patients from the hospitals with the prescription of probiotics. But how many millions, what type of probiotics to be used, that understanding and education we can give through medical promotion, through our field force, through media publicity, whatever way, health magazines. So this part is to be given enough importance for worldly population to have good health overall.
All right. Thank you so much for that, Ms. Bella. Dr. Kunal, what trends are you predicting? What are your metrics, if I may ask?
Right. So I think there are a lot of product wise, obviously there are certain products which are doing well, right? But segment wise, if we talk about, I think antioxidants are doing good. Joint care products are doing well, right? In products related to fertility are doing well in today's time. Obviously, immunity boosters are doing well, and then probably all your hair, skin, nail care products are doing well. So these are certain segments which we feel will do good in the years to come, right? And and we are developing a lot of products here, right? And I think everybody's mentioning about collagen. We have already seen great success of our collagen products in at least 7 to 8 countries where we are industry leaders today, right? Unfortunately, there is nothing called veg collagen today, right? But we are all working towards getting a collagen builder which is from veg source, right? So we could have an alternative and a vegan collagen product as well. So we are also working on that for the industries. Otherwise, like I think Bella mentioned, collagen comes from animal bones, right? In specific, right? So they're non-veg and non-vegan, non-halal also in some case, right? So it's not a product that we're looking for the MENA market, right? But veg collagen is something that we would also be keen on. Collagen builder in actuality, right, is something that we would also be looking at, right? But otherwise, we are seeing great response in the hair care, nail care, skin care segments where supplements are doing well. The biotin supplements, anti-aging products are doing well, right? So these are certain segments that will definitely grow in the years to come, because I think, like Bella mentioned, like she has a team of people who are in touch with consumers and seeing the trends and tapping on the demands of the consumers. We have to even if you don't do that, you get a basic idea of where the industry is growing. Because every year we get new age consumers who are entering the market, right? People who are making their own money, kids who are now adults and then they are independent, right? And the general trend is people want to be fitter, they want to be healthier, right? And they want to look good, correct? So anything that goes with this will work. And then on the other hand, we have an aging population. So an aging population will take your calciums, your joint care products, your immunity boosting products, goes across both segments. So I think Bella wants to say something.
I just want to add on, which throughout our discussion has missed out, fertility. And this is a great issue in youth.
Correct.
Reason: immunity versus stress versus infertility cases are on rise.
Yeah, absolutely.
And there is a need of nutraceuticals, immunoboosters. If immunity is better, all hormones will be in the level. And if hormones are, because I have been working with MNC and I have introduced estrogen, progesterone in Oman market, Primarin and Primpaxi, and what is the need? And even it has linking with the bone health and heart health. So vitamin E, vitamin D3 are involved in the absorption, then K2. But people should have understanding to the manufacturers, because in MENA region, there are so many infertility related nutraceuticals have been sold and are still in demand because the stress
Correct.
would be so many reasons, but stress, when increases, the need of vitamins by body increases. And when this goes in imbalance, antioxidants, nutraceuticals play a role. When stress, you lose the sparkle of your charm, whether you are young or old, irrespective. Now the trend to remain youthful. So type 1 collagen, skincare products, as you said, acne related products, biotin is very important along with B complex. So this part was missed out, and it is also one of the key issue to build up immunity and fertility and further maintenance.
Correct. So I think something that you just mentioned about for the stress, right, and how it's also impairing reproductive services, right? So this is something that I have just mentioned in my recent blog also, right? All about the gut-brain axis and the connection, how your mind can impact your gut microdata, and how your gut microbiota can cause other numerous problems in the body, right? So that's a very valid point.
All right. Thank you so much for sharing your thoughts, panelists. I think we've had some very, very good discussion here. Ms. Bella, Dr. Kunal, Vinisha, thank you so much for sharing your insights. I think you all have been wonderful panelists, and all of you have had a lot to share. I'm sure the audience has had a lot to learn from whatever all of you had to share. Once again, thank you so much for joining us despite the busy schedules that each of you have. It being a work day and right after summer, I know all of you are just back to your work desks, but thank you so much for doing this. And I'm sure the audience has definitely learned and would definitely be taking back a lot of things from whatever you've shared this afternoon. So to the audience who's tuning in, thank you so much for joining in. We've had a wonderful session and I hope you've enjoyed it. We have a next session coming up, which is on organic superfoods. It's scheduled to take place on the 21st of September at the same time between 3 and 4:30 UAE time. I look forward to meeting you all there once again. We also have, we are moving very quickly to the exhibition, which is scheduled to take place on the 13th to 15th of December 2022 at the Dubai World Trade Center. Exhibition booths are quickly selling off, and we're almost looking at a full house in terms of the floor plan. So in case you still haven't reserved your slot, please get in touch with us at info@organicnatural.com. And we look forward to seeing you all hopefully in Dubai in December. All right. Thank you so much once again, panelists, and have a great day. Thank you. Thank you.
It was our pleasure to be part of this session.
Thank you, Ms. Bella. Thank you so much. Thanks for joining.
Thank you, my colleagues, Dr. Kunal and Vanisha.
Thank you.
Thank you. Good speaking with you guys too.
Thank you.
Thank
you
you
so much.